The legalization of marijuana has been a controversial issue for decades now. According to an interview with Dr. Russell Fox, political science professor at Friends University, it was blacklisted in the early 1900s as a drug that should be illegal. Since then, it has been regarded as a hard drug that needs to be severely punished, along with other drugs such as cocaine, heroin, and methamphetamine. As research has continued, it is becoming more and more evident that the current political policy is completely outdated. The medical evidence in favor of using marijuana as a pain reliever in particular is clear, and the public is getting more and more restless to reevaluate and change the public policy on the legalization on the medical use of marijuana. In the early 1900s, marijuana became illegal for the first time in the history of the United States. Also at this time, prohibition was amended under the Constitution. Alcohol was then thought of as just as dangerous as marijuana and all of the other drugs such as cocaine, heroin, and methamphetamine. Currently, the thought of prohibition is outrageous. We have made laws prohibiting certain actions while under the influence of alcohol, such as drunk driving, and have also regulated alcoholic beverages according to the maximum amount of alcohol allowed in them. With all of the research supporting the benefits of medical marijuana, it is also outrageous to think the current policy is not outdated or what the people want. According to an article in the Chronicle of Higher Education, a protest is organized every year by the students at the University of Vermont in favor of the legalization of marijuana. This is just one of the many public protests in favor of helping those dealing with chronic, low-level pain have more options that are better for them. The medical evidence for the legalization of marijuana is overwhelming. Although there are physical and psychological effects for using marijuana, according to an article from WebMD, they are no more dangerous than smoking or drinking alcohol. Marijuana can be addictive among heavy users, but alcohol products can also be addictive.
Alcohol effects can be dangerous if there are not regulations in place like there are for alcohol. Alcohol can and will impair a person's judgment even with just one drink. There are laws regulating what activities can be done, such as driving. If the medical use of marijuana was legalized, there would be laws regulating its use, and most likely those using it are suffering from low-level pain and probably would not be participating in these activities anyway. According to an article on NORML.com, standing for the National Organization for the Reform of Marijuana Laws, the medicinal properties shown in the research is clear. The people of the United States and around the world also clearly distinguish from the use of medical marijuana for ill patients and patients in pain and the use of recreational marijuana. The medical properties include pain reliever, especially for those suffering from nerve pain and cancer patients undergoing painful treatments. These patients need a more effective pain reliever that is less addictive and will also leave them more lucid while they try and survive a terminally ill disease. Here are some pictures of some cancer patients that are in need of better options for them. Marijuana can also act as a treatment for patients suffering from HIV, AIDS, and dementia. Recent research also suggests that they protect the body from certain malignant tumors. Over 60 medical associations and 14 states have already voted in favor of legalized medical use of marijuana under doctor and regulation. This issue should not be ignored any longer. People have the right to be comfortable and the best option for surviving terminally ill disease or living with them. The government simply will not even allow people to vote on this issue. We are supposed to run by the people. Patients who benefit from the use of marijuana, doctors and patients have the right to decide where best options for them. I urge you to consider this issue to your own and push for updated legislation for legalization of the medical use of marijuana.